Burnett, a perinatal nurse in the Family Birth Center at Southwest Washington Medical Center. I, along with the healthcare team at the Southwest Family Birth Center, would like to congratulate you on the newest addition to your family and would like to thank you for choosing to have your baby at our hospital. In the months and years ahead, we look forward to offering classes, programs, and medical services to meet the needs of your entire family. We offer many classes for expectant and new parents. Our current class offerings for you to review are online with easy registration, which have been included with this DVD. After your delivery, we offer weekly drop-in support groups. Mother Share is one support group for the new mom and her infant up to 6 months of age. The Family Birth Center lactation staff facilitates a weekly breastfeeding support group. Both support groups are a great way to meet others experiencing the same challenges and joys of being a new mom. We realize that becoming a new parent is a wonderful experience and can seem overwhelming at times. So we are sending you home with these programs to help you with the transition of becoming new parents. The Newborn Care Program provides information on the day-to-day care babies and new mothers require. We have included an interactive play program that will teach you stimulating and fun ways to interact with your baby. We have also included a developmental milestone section to help you track your child's development from birth through age 2. Of course, the information contained in these programs should not be used as a substitute for the medical care and advice of your healthcare team. Your healthcare provider may recommend variations in care and treatment based on individual facts or circumstances. If you have any concerns about you or your baby, make sure you call your healthcare team. We hope you find these programs useful and that they help you enjoy every moment with your new baby. Welcome to the world of parenting.
Positions. It is very important to make sure that your baby's neck and head are always fully supported. Use only gentle, gradual movements while interacting with your baby. Some examples of different positions to use while interacting with your baby include placing your baby on his back in between your legs and leaning over so that he can see your face. If your baby is less than 3 months old, make sure to keep your face about 12 to 18 inches away from your baby's face so that he can see you. Cradling your baby in your elbow and supporting the head, neck, and spine with your arm. Use your other hand to support your baby's bottom. Holding your baby facing you, with one hand supporting the neck and base of the head, and the other hand supporting your baby's bottom. If your baby does not respond to a particular song or rhyme, don't force it. Move on to something else and try again later. 1 to 3 years. Here are examples of different positions to use while interacting with your toddler. Sitting with your toddler on the floor facing you. Sitting with your toddler on your knees facing you. Sitting with your toddler on your lap facing outward. Sitting with your toddler standing facing you. If your toddler does not respond to a particular song or rhyme, don't force it. Move on to something else and try again later. Immunizations.
Vaccinating children is one of the most important ways to protect their health and well-being. Vaccines provide immunity to disease. Vaccines protect infants and children from deadly diseases. It is easy to forget how serious these diseases are because, thanks largely to vaccines, very few people contract them. As recently as the mid-1980s, 20,000 children a year suffered from meningitis and other serious complications as a result of HIV disease. Measles used to kill tens of thousands of people in the United States every year. And in the 1940s and 1950s, tens of thousands of people were crippled or killed by polio. Parents often wonder why children need so many shots.
There are 14 potentially serious diseases that vaccines protect against: measles, mumps, rubella or German measles, diphtheria, tetanus, pertussis, also known as whooping cough, polio, Haemophilus influenza type B, also known as HIB disease, hepatitis B, varicella, or chickenpox, hepatitis A, pneumococcal disease, rotavirus, and influenza.
At least one shot is needed for each of these diseases, and for some of them, several doses are required for the best protection. This adds up to a lot of shots, and several are usually given at the same time. Some parents worry that it is not safe to give several shots at once, or that they may not work as well as they would if the shots were given individually. They also worry that so many shots at once might overload the child's immune system. But studies have proven these fears to be unfounded. Vaccinations are just as safe and just as effective when given together as they are when given separately. Several combination vaccines exist that administer multiple vaccines in a single shot. This reduces the number of shots needed. More combinations are being developed so that in the future, even fewer shots will be needed for the same number of vaccines. These dangerous diseases aren't as common as they used to be, but the diseases themselves have not changed. They still kill and injure children every year, even in the United States. Some of the diseases are rare here, but are common elsewhere in the world. When people come into the United States from other parts of the world carrying these diseases, there's a good chance that anyone who is exposed and not vaccinated will catch that disease. Many parents wonder why vaccines are given at such an early age. It is likely that your baby will receive her first vaccine, hepatitis B, even before leaving the hospital after birth. Vaccines are given at an early age because the diseases they prevent can strike at an early age. The ages at which vaccines are recommended are not arbitrary. They are chosen to give the earliest and best protection against disease. Some diseases are far more serious or common among infants or young children than they are among adults. For example, up to 60% of severe disease caused by Haemophilus influenza type B occurs in children under 12 months of age. Infants less than 6 months of age are at the highest risk for complications from pertussis, also known as whooping cough. In fact, 72% of children under 6 months who get pertussis must be hospitalized, and 84% of all deaths from pertussis are among children under 6 months. Vaccinations are very safe, but they are not perfect. Like any other medication, they can occasionally cause reactions. Usually these are mild, such as sore arms or slight fevers, and serious reactions are very rare. Your doctor or nurse can discuss the risks with you before the shots are administered. The important thing to remember is that getting the diseases is much more dangerous than getting the shots. It's important to know that shots work most of the time, but not always. Most childhood immunizations give immunity to 90 to 99% of the children who get them. But occasionally a child will not respond to a certain vaccine. This is another reason why it's important for all children to be vaccinated. A child who has not responded to vaccination has to depend on the immunity of others for protection. A child who hasn't been vaccinated could infect a child who has not responded to a vaccine. Sometimes a child should wait before getting certain vaccines, or should not get them at all. Review this list of questions each day an immunization is scheduled. If the answer to any of the questions is yes, inform your doctor or nurse. Is your child sick today with anything more than a common cold? Does your child have any severe allergies? Has your child ever had a severe reaction after a vaccination? Does your child have a weakened immune system because of diseases such as cancer or medications such as steroids? Has your child received a blood transfusion or any other blood product recently? Has your child ever had convulsions or any kind of nervous system problems? Does your child seem to be developing abnormally? Serious reactions to vaccines are very rare. However, if your child has any serious or unusual problems after getting a vaccination, call a doctor or bring the child to a doctor right away. Some parents are concerned that vaccines might make their children susceptible to other conditions. However, there is no credible scientific evidence to support a link between vaccinations to any other conditions, such as autism. Make sure to talk with your healthcare provider about any questions or concerns that you may have about vaccines.
Baby blues and postpartum depression.
The baby blues and postpartum depression are real conditions that many women experience after giving birth. It is important for new mothers and their families to know the difference between baby blues and postpartum depression. If you suspect you have postpartum depression, call your doctor immediately. During pregnancy, two female hormones greatly increase in women's bodies, estrogen and progesterone. In the first 24 hours after birth, these hormones rapidly drop back down to their pre-pregnancy levels. This quick change in hormone levels may contribute to the development of baby blues and postpartum depression, just as smaller changes in hormones can affect a woman's moods before her menstrual period. Other causes of baby blues and postpartum depression include drops in thyroid levels, which can occur in some women after birth. Additionally, lack of sleep, along with new responsibilities of a baby, can overwhelm a new mother. 60 to 80% of new mothers experience the baby blues, a mild form of depression that begins a few days to a week after delivery and generally lasts a couple of weeks. Symptoms include weepiness, moodiness, anxiety, and irritability. The baby blues will go away on their own, and they do not require medical treatment. 10 to 20% of new mothers develop postpartum depression, which can last from 2 weeks to as long as a year. Postpartum depression can happen any time within the first year after childbirth. While the baby blues and postpartum depression have some common symptoms, there are differences. Postpartum depression requires medical treatment from your doctor. If you have any of the following symptoms, call your doctor immediately. Your baby blues last longer than a couple of weeks. You find yourself unable to properly care for your baby or yourself. Insomnia, weepiness or sadness that persists all day, difficulty concentrating, change in appetite, intense anxiety, intense moodiness and irritability, suicidal thoughts. You have thoughts of harming yourself or your baby. Panic attacks with symptoms that include heart racing, dizziness, confusion, and feelings of impending doom. Tips that help new mothers cope with baby blues and postpartum depression include: obtain professional help if you think you might have depression. Get help with the cooking, housework, and baby care from friends, relatives, or your significant other. Sleep when the baby sleeps. Don't put pressure on yourself to get everything done. Take some time for yourself. Go outside to get some fresh air. Join a mother's group or a support group.
Worsening condition may include hallucinations and paranoia. Call your doctor immediately if these occur.
6 to 12 months. Make sure to use only gentle, gradual movements while interacting with your baby. Some examples of different positions to use while interacting with your baby include placing your baby on his back in between your legs and leaning over so that he can see your face. Cradling your baby in your elbow and supporting the head, neck, and spine with your arm. Use your other hand to support your baby's bottom. Holding your baby facing you, with one hand supporting the neck and base of the head, and the other hand supporting your baby's bottom.
Holding baby facing out on your lap with your body supporting the head.
If your baby does not respond to a particular song or rhyme, don't force it. Move on to something else and try again later. Newborn appearance. Often, new parents expect their infant to look like the babies we see in commercials, with perfectly round heads and flawless complexions. But the reality is that most newborns don't look like that at all. They've been living in cramped, wet quarters, which wrinkle and often redden their skin. Babies that have been through a vaginal birth have had a journey through a small birth canal. This can result in a pointy-looking head, distorted ears, a flattened nose, an asymmetrical chin, and bruising. Don't worry. These characteristics will normally disappear in a few weeks. If you have any concerns about these conditions, please talk with your baby's doctor. Babies are born with fontanelles, or soft spots on their heads where their skulls have not yet fused. You might notice these areas moving as your baby's heart beats. This is normal. The back soft spot will close at about 6 months of age, and the front spot will close before your baby's second birthday. At birth, babies may be covered in vernix, a cheese-like coating that protected their skin in utero. Most of the vernix will wash off, but some will remain and will be reabsorbed into the skin. Many babies are also covered with lanugo, a downy prenatal fuzz that is normally found on the shoulders, back, forehead, and cheeks. Lanugo will disappear within a few weeks. Newborns are affected by hormones passed from their mothers during pregnancy for the first few weeks of their lives and will be affected even longer if they are breastfed. As a result, it is common for newborn babies, both male and female, to have swollen breasts, which may emit a small amount of discharge, and it is common for boys to have swollen genitals. Newborn girls might have a discharge along with a little blood from the vagina, which can usually be wiped away on a single tissue. This is normal. If you are concerned that your baby's symptoms are unusual, check with your baby's doctor. Other common newborn conditions that appear during the first days of life include miliaria, which are small raised red bumps, milia, which are white or yellow spots on the nose and chin. Both of these conditions will go away within the first weeks of life. Jaundice is a common medical condition in newborns. Most of the time it develops during the first few days of life and is gone after a couple of weeks. More than half of babies that are born have at least a mild case of jaundice. The symptoms include yellowing of the skin and yellowing of the whites of the eyes. Jaundice is caused by excess bilirubin, a substance produced by the breakdown of red blood cells. Sometimes babies can't pass the bilirubin quickly enough, and sometimes excess bilirubin is made or reabsorbed, which results in jaundice. Most cases of jaundice do not require treatment. When treatment is needed, phototherapy is administered. The baby is placed unclothed under an ultraviolet lamp, referred to as a billy light, or in a special blanket with a fiber optic light called a billy blanket. Sometimes the billy light and the billy blanket are used together. The light causes bilirubin levels to fall to safe levels by breaking the bilirubin down into less dangerous byproducts. Babies may either be treated at the hospital or at home with a portable phototherapy light unit, such as a billy blanket. If you think your baby may be jaundiced, or if you have any questions about jaundice, consult your baby's doctor. Thrush is an infection of the mouth caused by yeast. The symptoms are a cottage cheese-like substance that coats the sides, roof, and tongue of the mouth. Thrush is a common newborn ailment and may need to be treated with medication. Talk to your baby's doctor to determine what treatment, if any, is needed. It is normal for babies to get thrush throughout the first year of life. Cradle cap is another very common newborn condition. Symptoms of cradle cap include flaky, dry skin that looks like dandruff, or even thick, oily, yellowish scaling skin and crusting patches. You also may see these symptoms on your baby's eyebrows, ears, armpits, or neck. Frequent shampooing and brushing of your baby's scalp can help reduce cradle cap. Most often, it shows up in the first few months of life, and it usually clears up on its own after several months. However, in some cases, it can last longer. If your baby has a moderate to severe case of cradle cap, your baby's doctor might recommend a treatment. Sleep patterns. During pregnancy, your baby slept a lot during the day because your movements rocked your baby to sleep. In fact, your baby's most wakeful periods occurred during the night while you slept. Usually, it takes a few weeks to change your baby's habits. You can help overcome day-night confusion by keeping your baby's sleeping area dark at night and by making sure that your nighttime feedings and diaper changes are done calmly and quietly. Newborns typically sleep about 16 hours a day during the first month of life. However, each baby is an individual and will have a unique sleeping pattern. Consequently, some newborns sleep less and some more. Usually, sleep patterns center around feedings. New babies will typically sleep in stretches of 2 to 4 hours and then wake to be fed. Newborns may only be alert for a few minutes at a time, totaling an hour of wakefulness during each 24-hour period. Babies generally start sleeping for longer periods in the evening when they are about 6 weeks old. By the end of their first months, babies will have longer periods of alert time, up to a few hours a day, and longer periods of sleep. Consistent sleep-wake patterns typically develop at approximately 3 to 4 months of age. Your baby will probably take several naps each day, totaling 3 to 5 hours, and sleep about 10 hours at night. Many babies can sleep in stretches of 6 to 8 hours during the night. If you have any questions or concerns about your baby's sleeping patterns, please consult your baby's doctor. Eating patterns. Newborn babies will eat every 2 to 4 hours, and sometimes as often as 1 to 3 hours. Feeding should occur whenever your baby is hungry. Common signs that your baby is hungry include increased alertness, sucking sounds, or opening his mouth wide and searching for your breast, which is called the rooting reflex. If your baby is crying due to hunger, she has already been hungry for a while. As your baby gets older, she will feed less often at night. Many babies drop a nighttime feeding sometime between 6 weeks and 3 months. Abnormal feeding behavior may be one of the first clues that a baby has a medical problem. Call your baby's doctor if your baby wakes to eat less often throughout the day, refuses to eat, or eats less than usual for 3 consecutive feedings. Wet diapers and stools. Pay close attention to the number of wet diapers your baby has within a 24-hour period. Your baby may urinate every 1 to 3 hours, but many babies wet less often. Your baby should wet at least 1 diaper per day of life during the first week of life. For example, a 3-day-old baby should have at least 3 wet diapers. By the 6th day of life, your baby should wet 6 to 8 diapers a day. If your baby is not wetting at least 6 diapers a day by the end of the first week of life, consult your baby's doctor. Baby's first soiled diapers will contain a greenish-black substance called meconium, which can be thick and tarry. Meconium builds up in baby's intestines during pregnancy. After the meconium has passed, your baby will have transitional stools, which are dark greenish-yellow and loose and can appear seedy in texture. It is not uncommon for mucus to be present in the stool. After several days of transitional stools, baby's stools will change again. If you are breastfeeding, the stools might be a mustard color, loose, watery, and/or seedy. If you are bottle feeding, the stools might be a little more formed than those of a breastfed baby. The color will range from pale yellow to brown or green. If the diaper appears orange or pinkish tinged, it may be uric acid crystals. Urate crystals in the first few weeks of life are relatively common and do not harm the newborn. The frequency of stools can vary. Call your baby's doctor if, after the meconium has passed, baby's stools are red, black, or white. Crying. Your baby may not cry a lot during the first few days of life because he's sleeping so much. But by the second and third week, the amount of crying can increase substantially, especially in the evening, which can be a fussy time for many babies. Infants cry for many different reasons: if they are hungry, tired, bored, wet, or for no apparent reason at all. After some time, you will probably be able to detect and respond to your baby's different cries. It is impossible to spoil a baby during the first year of life, so go ahead and hold, cuddle, and reassure your baby. However, if you are feeling frustrated, gently place the baby in the crib and go to another room for a few minutes until you calm down. Colic. Between 10% and 30% of babies have a condition known as colic. Babies are termed colicky when they cry inconsolably for stretches of several hours or more for weeks at a time. Colicky babies may also seem to be in pain, screaming, and drawing their legs up to their bellies. There is no known cause for colic. The crying is not due to hunger, illness, a wet or soiled diaper, or any other known reason. Colic typically appears in the second or third week of life, peaks at about 6 weeks, and diminishes by about 12 weeks. Colic occurs in both breastfed and bottle-fed infants who are healthy, growing, and eating well. Colic can be very frustrating for parents. If you suspect that your baby is colicky, talk to your baby's doctor. If you feel frustrated, ask for help from a spouse, relative, or friend. It may also help to join a parenting group. If your child is vomiting, seems to be sick, or you are concerned about her health, talk to your baby's doctor to rule out any potential medical causes. Breastfeeding. Before you begin breastfeeding, find a comfortable spot and try to relax. Drinking a glass of water or juice before and during feedings gives your body the liquid it needs to produce milk. You should feed your baby often, every 2 to 3 hours, beginning right after birth if possible. The milk that you produce immediately after giving birth is called colostrum, which is a thick yellowish fluid that is rich in antibodies and helps to protect your baby from getting sick. It can take several days for a more abundant supply of milk to come in, and nursing your newborn often facilitates the letdown reflex, which allows milk to be squeezed out of your milk-producing cells into the nipple. The letdown reflex is triggered by the release of oxytocin from the mother's pituitary gland. Letdown can take a few minutes to occur during the first weeks of nursing. Your baby will get a small amount of milk until letdown occurs, but she will receive comfort from sucking. Sometimes, women will experience a fullness of the breast, a tingling sensation, or uterine cramps during the letdown process. This is normal, but it is also normal not to have any symptoms. Your baby will receive foremilk at the start of the feeding, which is high in protein but low in fat. Hindmilk, which follows foremilk in the feeding, is higher in fat and calories. If your baby feeds for only a few minutes on each side, he may receive mostly foremilk and may not receive the nutrients and calories he needs to grow. He may also be fussy, gassy, and irritable. For this reason, it is recommended that your baby be offered the first breast as long as he seems interested, at least 10 minutes of consistent suckling and swallowing, or until he releases the breast. The amount of milk your baby drinks at each feeding will gradually increase. During the first few days of life, your baby will drink 1 to 3 teaspoonfuls per feeding. By the 4th day, your baby will be drinking 1 to 3 ounces per feeding. Several different positions facilitate breastfeeding. Try all of them to determine which positions work best for you and your baby. The cradle hold. Choose a comfortable position. Cradle your baby in one arm with her head at your elbow and her bottom in your hand. Hold your baby at breast level, using pillows or folded towels for support. Bring your baby to the breast, rather than leaning forward to your baby. Hold your baby chest to chest at breast level. You can support and shape your breast with your hand by placing your fingers and thumb opposite one another on your breast, forming a U shape. Shaping your breast between your thumb and fingers makes it easier for your baby to latch on. Side lying hold. Lie on your side, placing pillows behind your back, between your knees, and under your head for support and comfort. Position your baby on her side, placing her tummy to tummy with you. You can support your breast by placing your fingers and thumb opposite one another on your breast, forming a C shape. Shaping your breast makes it easier for your baby to latch on. The side-lying position gets easier as your baby grows and develops better muscle control. The cross-arm cradle, which is also called the cross-cradle hold. Your baby is positioned facing you, similarly to the cradle hold. You may want a pillow behind your back and pillows or folded towels across your lap for comfort and support. Use your same side hand to support your breast. Right hand for right breast, left hand for left breast. Position your fingers and thumb opposite one another on the breast, forming a U shape. Bring your other arm behind your baby's body and hold the lower head and neck with your hand, making sure the palm of your hand is on your baby's upper back at the base of the neck. The football hold, or clutch position. Position your baby so that her legs and body are tucked under your arm. Gently bend your baby's hips, placing her bottom against a pillow so she can't use her legs to push away from the breast while eating. Place your hand on her upper back at the base of the neck, with your fingers supporting her neck and lower head. Place a pillow under your arm to help provide support and prevent fatigue. If you need to support your breast, position your fingers and thumb opposite one another on your breast, forming a C shape. Shaping your breast makes it easier for your baby to latch on. Latching on. Once you are both in position, it is time to have your baby latch onto your breast. Place your thumb and fingers opposite one another on your breast. Make sure your thumb and fingers are away from the areola, which is the dark area at the base of the nipple. Gently brush your baby's lips with your nipple. You can also squeeze a few drops of milk from your breast to encourage your baby to open wide and latch on. Once your baby's mouth is open wide, pull him onto your breast. If your baby's mouth is not covering both the nipple and a good portion of the areola, then break the suction by slipping your finger between your baby's gums and your nipple and try again. Make sure you don't try to pull your baby from the nipple without breaking suction. That would be very painful. It is important to have both the nipple and a good portion of the areola in your baby's mouth, because when a baby sucks only the nipple, less milk is released. It is the stimulation of the areola that drives milk into the nipple and then into your baby's mouth. If your baby is sucking only the nipples are likely to become painful, irritated, and cracked. The pain from sore nipples and a mother's anxiety about it can further inhibit milk flow. Once your baby has latched on, make sure his lips are turned out. Sometimes babies will suck their lips, which prevents them from getting milk. If necessary, break the suction by placing your finger between your baby's gums and your nipple and try again. Check for a steady rhythmic motion in your baby's jaw, with the jaw dropping deeply for each suck. These are signs that suckling is in progress. It is normal for babies to lose some weight during the first week of life and then to regain it during the second week. Pediatricians watch babies' weight very closely to make sure they are getting the nourishment they need. Talk to your baby's doctor about any questions or concerns you may have about your baby's weight. Once your milk supply increases, you will feed your baby between 8 and 12 times in each 24-hour period, including nighttime feedings. Start with one breast and let your baby nurse until he is finished. Then burp your baby and switch to the other breast. Most babies empty a breast in 10 to 20 minutes. If your baby spends more than 20 minutes on each breast, discuss it with your baby's doctor. Be sure to alternate the breast you offer first. It is easy to forget which breast you last started with, but you can remind yourself by switching your watch after every feeding to the side you'll start with the next time. Or you can pin a safety pin to your nursing bra to indicate the side you'll start with next time. Look for these signs that your baby is getting enough milk. You can see your baby sucking. You can hear your baby swallow. Your baby has at least 6 to 8 wet diapers each day, beginning in the 6th day of life. Your baby's urine should be pale yellow, not deep yellow or orange. Your baby has several bowel movements each day during the first month. After the first month, the frequency may lessen. After you have finished feeding and burping, if your baby seems irritable or restless, it is possible that he's not getting enough milk. If you are concerned that your baby is not getting enough milk, call your baby's doctor immediately. Contact the lactation nurses at the hospital or your baby's doctor immediately if your baby does not regain his birth weight or surpass it by 2 weeks of age. Is not having yellow stools by day 5. Seems excessively fussy or excessively sleepy. Does not feed well after you leave the hospital. You should contact the lactation nurses at the hospital or your baby's doctor if you or your baby are not getting the hang of the latch technique. Your nipple looks distorted after feeding or remains painful or cracked beyond a few feedings. You are feeling anxious, overwhelmed, or depressed since giving birth. You are experiencing challenges feeding your baby. Nursing equipment. Nursing bras and breast pads can make breastfeeding easier. Nursing bras have separate flaps at each breast, which make it possible to feed your baby without taking off your bra. Nursing pads are either disposable or washable cotton pads that are placed into each side of the bra to absorb leaking milk. Change them as soon as they are wet. Expressing milk. Expressing milk is a wonderful way for mothers to provide breast milk for their babies when they can't be with their baby to breastfeed or if their babies are unable to nurse at the breast. There are several different ways to express milk: by hand, using a manual pump, or using an electric pump. Some women prefer one method, while others use all of the methods from time to time. Which methods you use depend on your needs and preferences. There are many different types of pumps available. Talk to your lactation consultant to find out about different products. You may be able to rent a pump from a hospital, a pharmacy, or a board-certified lactation consultant in private practice. Before you express milk, wash your hands or clean them with hand sanitizer. If you are using a breast pump, make sure that the components have been cleaned with hot soapy water or in the top rack of the dishwasher. Make sure to follow the directions that came with your breast pump so that it is assembled properly. If your pump came with soft silicone or rubber fittings, make sure there are no holes or tears in them. Otherwise, your pump may not work correctly. You'll also need to check to make sure that all of the fittings are tight and secure. Some women produce milk as soon as they start to express, and others require several minutes before letdown occurs. There are several things you can do to help get the milk flowing. Place warm compresses on the breasts. Breast massage can also help. Use the pads of your fingers to gently massage around the breast. Start at the chest wall and use a circular pattern, working your way from the chest wall down the breast towards the areola. Many moms think about their baby or look at a picture of their baby to help them relax and get the milk flowing. Expressing milk by hand. It's a good idea for nursing mothers to know how to hand express milk. Hand expression can be used if you are feeling engorged and don't have your baby or a pump with you. Some moms become so proficient at hand expression that they empty their breast as quickly as if they were using a pump. Hand expression is also used by many moms at feeding time. Expressing a few drops of milk from the breast at feeding time is a good way to encourage your baby to latch on. Before you get started, you'll need a container or a towel to catch the milk. If you plan to save the milk for your baby, make sure that the container has been cleaned. Next, place your fingers 1 inch to 1.5 inches behind the nipple, with your thumb above your nipple and your index and middle fingers beneath it. Press back and then roll your thumb and fingers forward. Continue to compress and release until milk flow slows. Then gently massage the breast from chest wall to nipple. Place your thumb and finger on different places in the areola, still 1 inch to 1.5 inches behind the nipple, working your way around the entire areola until all of the milk ducts have been emptied. Expressing milk using a manual pump. Using a manual pump is another way to express milk. A manual pump is small and portable and does not require batteries or an electrical outlet. The manual pump works well for moms who only pump occasionally. To use the pump, place the nipple through the center of the opening of the breast flange, with the flange surrounding the areola. You will feel some tugging as you start to pump, but it should not hurt. If it feels uncomfortable, then you will need to reposition the flange on the breast. Once the flange is positioned properly, use your hand to compress the outside of the pump. The timing of the suction is determined by how fast or slow you compress the pump. You should compress the pump at a rate that is comfortable for you. Expressing milk using an electric pump. There are 2 types of electric pumps: single electric pumps, which express milk from one breast at a time, and double electric pumps, which express milk from both breasts simultaneously. Expressing milk using a double electric pump is typically the fastest and most efficient method of expression. The double electric pump is an excellent choice for mothers who will be expressing milk regularly. For example, working mothers and mothers whose babies cannot nurse at the breast. Make sure that all of the components are properly connected and secured. Check tubing connections and make sure that twist-on connections are tight. Many types of electric pumps allow you to determine the speed at which the pump operates and how much suction is provided. Start at the middle range of both settings and adjust the settings up or down as needed. The suction should be strong enough and the speed should be fast enough to extract milk, but you should not feel pain or discomfort. Some mothers vary the settings throughout a session, and others will use the same settings for an entire session. Start by placing one of the flanges on the breast. Be sure the nipple is centered in the middle of the opening of the flange. Turn on the breast pump and then place the remaining flange over the other breast. Again, be sure that the nipple is centered in the middle of the flange opening. As the pump creates suction, you should feel and see your nipple being drawn into the flange opening. It may be necessary to readjust the flanges if they are not centered correctly. If the flanges are correctly centered and the nipple does not seem to extend into the flange, or if it feels like it is rubbing, a larger flange opening may be needed. A typical expression session using a double electric pump lasts for at least 10 to 12 minutes. If milk is still spraying after 10 to 12 minutes, continue to express until milk flow slows or has stopped. The amount of milk you obtain can vary from session to session and depends on many factors. Talk to your lactation consultant if you have questions about the amount of milk you are producing. How often you express milk depends on your reasons for expressing. For example, if you are expressing milk because you will be away from your baby, try to express as often as your baby would nurse when he is with you. Talk to your lactation consultant to determine an expressing routine that best meets your needs. Your health during breastfeeding. Continue with the same healthy diet you consumed during your pregnancy. If you need help improving your diet, please talk with your lactation consultant, a nutritionist, or your doctor. It is essential to drink plenty of liquids. A good rule to follow is to have something to drink every time you have a meal, snack, or when you feed your baby. While you are breastfeeding, you may want to limit the foods you eat that disagree with your baby's system. It usually takes 4 to 6 hours for food to get into your milk supply. If a food seems to irritate your baby, avoid it. For example, caffeine can cause babies to become restless and irritable, so minimize your caffeine intake as much as possible. Also, breastfeeding mothers should avoid some types of fish due to their mercury content. Call 888-SAFE-FOOD for more information and to receive guidelines on which types of fish are safe to eat. If allergies or asthma run in your family, talk to your doctor to determine if there are specific foods or beverages that should be avoided while you are breastfeeding. And while breastfeeding, do not take any medications without consulting your doctor and your baby's doctor first. Like other foods and chemicals, alcohol and drugs get into your breast milk. Alcohol and illegal drug exposure are dangerous for infants and young children because of their potential harm to the developing brain. Exposure to harmful substances can lead to behavior, learning, and coordination problems. Therefore, breastfeeding mothers should avoid these substances. Cigarette smoking by adults is also harmful to babies. Secondhand smoke can be harmful to your baby's growth, health, and development. Babies exposed to cigarette smoke in the home have a higher risk of SIDS, sudden infant death syndrome. These children also have higher incidences of respiratory problems including asthma, pneumonia, allergies, and ear infections. Even if a baby is not exposed to smoke, cigarette smoking by a nursing mother decreases her milk supply, which could interfere with successful breastfeeding and could affect the growth of her baby. Continue your prenatal vitamins while breastfeeding. If you need to take any other over-the-counter medications or prescription medications, make sure that your prescribing doctor knows you are breastfeeding. A gradual return to exercise is recommended for all new mothers. Weight loss should be slow and well monitored. Storing and thawing breast milk. Store breast milk in BPA-free bottles or pre-sterilized bags designed especially for breast milk. Store milk in single servings. The amount of milk in a single serving will change as your baby grows. Leave some room at the top of the container because milk will expand when it is frozen. Label each container with the date and time. Freshly expressed breast milk can be stored at room temperature for 4 to 6 hours. It can be stored in a refrigerator for 3 to 8 days and can be stored in a freezer for 6 to 12 months. Do not store breast milk in the door of a refrigerator or freezer. These guidelines apply to healthy, full-term infants. Thaw breast milk in a refrigerator or in a bowl of warm water. Never thaw breast milk in a microwave. Microwaves heat food unevenly, causing hot spots that may go undetected even after testing a few drops of milk on your wrist. Hot milk can burn your baby. Use thawed breast milk within 24 hours. Do not refreeze breast milk once it has been thawed. Bottle feeding. Formula is packaged in several different ways: powder that is mixed with water, ready to feed, and concentrated liquid that is diluted with water. There are also several different types of formula. Formula is made from cow's milk, soy protein, or pre-digested protein. Formula made from pre-digested protein is called hydrolyzed formula. Soy-based formula and hydrolyzed formula are typically used when a baby is allergic to cow's milk. Ask your baby's doctor what type and brand are best for your baby. Do not give your baby anything but breast milk or the formula your baby's doctor recommends. Regular cow's milk, soy milk, or any other kind of milk is not sufficient to meet your baby's nutritional needs. Babies require all of the extra vitamins and minerals in breast milk and baby formula. Typically, babies do not start drinking cow's milk until they are at least 1 year old. Talk to your baby's doctor about the appropriate time to switch from formula to cow's milk. Many types of bottles and nipples can be used to feed your baby. Nipples are typically marked by age and rate of flow to help you determine which nipple to use. If the nipple opening is too small, your baby will have to work extra hard to get the milk out of the bottle. And if the nipple opening is too big, your baby can choke on a gush of formula. When you prepare a bottle, always wash your hands. Before you use bottles for the first time, wash all the parts, including the bottle itself, the collar, and the nipple. If you wash your bottles by hand, use hot water and dish soap. Use a bottle brush to clean the bottles and use a nipple brush to clean the nipples. Squeeze soapy water through the hole in the nipple. Then squeeze hot, clear water through the nipple several times. Rinse everything under hot, clear water. Let your bottles air dry on a clean towel or a bottle drying rack. If you wash your bottles through the hot cycle of a dishwasher, separate all of the parts, bottle, collar, and nipple, before placing them in the dishwasher. Always check the expiration date on the container before using it. Prepare formula according to the directions found on the container. Read the directions each time a new container is used to make sure the directions haven't changed. Formula that is overly concentrated can damage your baby's kidneys. Formula that is too diluted may not provide adequate nourishment. Never add a supplement to your baby's formula unless instructed by your baby's doctor. Formula or breast milk can be served cold, at room temperature, or warm, whichever your baby prefers. If you decide to heat the liquid, never use a microwave. Hot spots can exist that you cannot feel from touching the bottle or even from testing a few drops on your wrist. Your baby's mouth or throat can be burned. Instead, run the bottle under warm water or place it in a bowl of warm water. Once your bottle is prepared, shake a few drops on your wrist to ensure the temperature is acceptable. Find a relaxing, comfortable place to sit. Hold your baby in a semi-erect position. Your baby's head should be on the inside of your elbow and her bottom in your hand. Guide the nipple gently between your baby's lips and tilt the nipple so that it is always filled with formula. This prevents your baby from swallowing air, which can cause discomfort. Burp your baby halfway through the feeding and again at the end. Feeding is a great way to spend one-on-one time with your baby, helping the two of you bond. Quietly talk to and cuddle your baby. Never prop up a bottle or put your baby to bed with a bottle. Your baby could choke. Laying baby down with a bottle can also cause tooth decay and possibly ear infections. After you have finished your feeding, discard the remaining formula promptly. It is safe to prepare more than one, even up to a day's worth of bottles, but don't keep them in a refrigerator for more than 24 hours. Do not freeze formula. Burping. Babies swallow air along with milk when they suck from a nipple. This can make your baby feel full and uncomfortable before she is actually finished with a meal, and can also cause your baby to spit up. Your baby should be burped every 2 to 3 ounces if you are bottle feeding, and between breasts if you are breastfeeding. If your baby hasn't burped after several minutes, continue feeding her. Once you have finished feeding, burp your baby and hold her upright for about 10 minutes to prevent spitting up. It is a good idea to use a cloth diaper or towel to protect your clothing in case your baby does spit up. There are 3 main positions for burping. You can hold your baby upright with her head resting comfortably on your shoulder. Make sure that her head is turned to the side so that she can breathe easily. You can sit your baby on your lap, supporting her chest and head with your hand while gently patting and rubbing her back with your other hand. Or you can lay your baby on his stomach on your lap. Hold him securely with one hand while you gently pat and rub his back with the other. Bonding with baby. Newborns are very sensitive to touch. Cuddling, stroking, and swaddling provide your baby with a feeling of comfort. Babies delight in closeness, hearing your heartbeat and smelling you. Talk to your baby during feeding, holding, and changing times. Newborn infants can focus on objects. Your face is baby's favorite thing to focus on. Spend time holding and talking with your baby. Even newborns respond to faces and voices. Try sticking out your tongue several times when your baby is being attentive. He'll stick his tongue back out at you. It is important for you to become aware of your baby's needs. Over time, you will be able to discern the meaning of your baby's different cries and cues, and know how to respond to them. Talking to, playing with, and holding your baby will stimulate your infant's senses and further develop the bond that is forming between you. Remember that infants have very short attention spans and can be overstimulated. If your baby begins to be fussy or look away from you, it is time to let her rest. Holding baby. Whenever you hold your infant, it is important to support his neck and head. Newborns have not developed the strength in their neck muscles to enable them to hold up their heads on their own. Here are several of the most common ways to hold your baby. You can cradle baby in your elbow and support the head, neck, and spine with your arm. Use your other hand to support baby's bottom. This is called the cradle hold. The football hold is a good position to use if you need a free hand. Hold your baby's head and neck in your hand. Your arm will support her back, spine, and bottom. The over-the-shoulder hold is a position often used for burping. Make sure your baby's head rests comfortably on your shoulder and that his face is turned to the side so that he can breathe easily. Diapering. Babies need their diapers to be changed frequently in the first months of their lives. Your baby may go through more than 10 diapers a day. It's a good idea to change baby's diaper before or after every daytime feeding and whenever baby has a bowel movement. Keeping baby's bottom dry will help prevent diaper rash. Make sure to wash your hands before you change your baby's diaper and make sure that everything you need is on hand. Never leave a baby unattended on a changing table or other high surface, and always keep baby within arm's reach. Even very young infants have been known to roll off the table. You will need a clean diaper, a cotton washcloth or cotton balls, and warm water or baby wipes. Fragrance-free baby wipes can be less irritating to an infant's sensitive skin. Ask your baby's doctor for her recommendation. Zinc oxide, if needed, for diaper rash. And a change of clothes in case the diaper has leaked. First, unfasten the diaper. Clean baby's front thoroughly with a washcloth, cotton balls, or wipes. Lift the legs and thoroughly clean baby, taking care to wipe front to back. Open a diaper and place it under baby so that the back of the diaper is about level with your baby's navel. If necessary, apply diaper rash ointment. Bring the front of the diaper up between your baby's legs and onto his belly. Fasten snugly with the adhesive strips. Until the umbilical cord stump falls off, fold the top of the diaper down to prevent it from rubbing against the navel. When disposing of a diaper, fold it, retape it, and discard it. Wash your hands again after you have disposed of the diaper. If you have chosen to have your son circumcised, you will need to take special care of the penis until healing is complete. Care for the penis is directed by your baby's doctor. If you have chosen not to have your son circumcised, ask your baby's doctor for a recommendation on care. Cord care. The umbilical cord stump usually falls off in the second or third week of life. Until the cord falls off and heals, it should be kept clean and dry. Keep the baby's diaper folded below the stump area. The air will help dry the stump. If the cord is soiled with urine or stool, clean it with water. The stump may bleed slightly when it begins to fall off. This is normal and should not cause concern unless it continues. Your baby's belly button should be healed in 5 to 10 days. No special care is needed after this time. Call your baby's doctor if the area around the cord, including the skin, is red, swollen, or has a foul-smelling discharge. Taking temperature. It is important to know how to take your baby's temperature. Acceptable methods of measuring a baby's temperature include axillary or rectal measurements. The axillary method consists of taking your baby's temperature in her armpit. First, clean the end of the thermometer with rubbing alcohol or soap and water. Rinse it with cool water. Do not rinse with hot water. Remove your baby's clothing so that there is nothing between the thermometer and baby's skin. Place the tip of the thermometer well up into the armpit and hold the arm snugly over it, gently pressing the elbow against your baby's side. Listen for the beep that signals the reading is complete and remove the thermometer from your baby's armpit to check the digital reading. Make sure to clean the thermometer with rubbing alcohol or soap and water before putting it back in its case. During the first 3 months of life, call your doctor if your baby has an axillary temperature of 99 degrees or higher. Some pediatricians recommend taking a baby's temperature rectally. If a child is younger than 3 years of age, taking his temperature with a rectal digital thermometer provides the best reading. First, clean the end of the thermometer with rubbing alcohol or soap and water. Rinse it with cool water. Do not rinse with hot water. Put a small amount of water-soluble lubricant, such as KY jelly, on the end. Remove your baby's diaper and place him belly down across your lap or on a firm surface. Hold him by placing your palm against his lower back, just above his bottom. With the other hand, turn on the thermometer switch and insert the thermometer 1/2 inch to 1 inch into the anal opening. Do not insert the thermometer too far. Hold it in place for about 1 minute until you hear the beep. Remove the thermometer to check the digital reading. Make sure to clean the thermometer with rubbing alcohol or soap and water before putting it back in its case. During the first 3 months of life, call your doctor if your baby has a rectal temperature of 100.4 degrees or higher. Changing clothes. Make sure that the clothing you select for your baby is soft, comfortable, and machine washable. Wide-neck t-shirts or undershirts that snap on the side or at the crotch are recommended. One-piece rompers that snap in the front are also good choices. They are easy to put on and take off. When you are putting baby's arms through the holes, reach for her hands and gently pull them out. Follow the same procedure with pants and shorts. Nail care. Trimming your baby's nails is essential so that she will not accidentally scratch her face. Look at them frequently to determine when it is time for a trimming. The hospital recommends use of a small emery board to smooth your baby's nails instead of scissors. If you choose to use scissors, try to cut your baby's nails while she is sleeping. It can be challenging to try and trim them when your baby is awake. Always use baby nail scissors. Their size and rounded edge help to protect your baby from being cut. Push the finger pad down when you cut so it will be out of the way. If you accidentally draw blood, apply pressure with a sterile gauze pad until bleeding stops. You can also use a small emery board to smooth your baby's nails after and in between trims. Sponge bath. You will give your baby a sponge bath until the umbilical cord stump has fallen off and has healed. Before you begin the sponge bath, make sure to wash your hands and have everything you will need for the sponge bath within reach. Always keep your baby within reach. If you need to step away for any reason, even for a moment, take your baby with you. You will need washcloths, one for soaping and one for rinsing, cotton balls, baby bath soap and baby shampoo, a baby brush or comb, 2 towels, a clean diaper and clothing, and warm water. Test the water temperature by sticking your elbow in it. It should feel warm, not hot or cold. Undress your baby and wrap her in a towel. Expose only the part of her body that you are washing to prevent her from getting cold. Begin by washing your baby's hair. Hold her in a football hold and gently work a small amount of baby shampoo through her hair. Rinse thoroughly. Towel dry. And brush her hair with a baby brush or comb. Take care to wash your baby on a flat surface. If it is hard, place a pad or towel underneath your baby. After shampooing, wash her face. You won't need to use soap on your baby's face. First, moisten a cotton ball or washcloth with warm water, and then wash the eyes, starting at the inner part of the eye and working out. Use a separate cotton ball for each eye. Then wash the rest of the face and ears. Next, wash the neck, making sure to clean all of the folds. Then, wash the arms, back, and legs. When you wash the stomach, make sure you don't get the umbilical cord stump wet. Leave the diaper area for last. Remove the diaper and wash the area thoroughly from front to back. If your baby boy has recently been circumcised, care for the penis as directed by your baby's healthcare provider. When you have finished, diaper baby, and then dress her. Tub bath. Before you bathe your baby, make sure to wash your hands and have everything you will need for the bath within reach. Remember to always keep your baby within reach. If you need to step away for any reason, even for a moment, take your baby with you. Before you get started, you'll need a place to bathe your baby, a baby tub, basin, or sink. Make sure the bathing area has been properly cleaned and rinsed. You will need washcloths, one for soaping and one for rinsing. You may also use a cup for rinsing. Cotton balls, baby bath soap, and baby shampoo. A baby brush or comb, a towel, and a clean diaper and clothing. Place about 2 inches of warm water into the tub. Test the water with your elbow to make sure that it is warm. Undress your baby completely. Hold him very securely and place him into the tub. Make sure his neck and head are supported. First, you'll wash your baby's face. It is not necessary to use soap on your baby's face. Take a wet washcloth or a moistened cotton ball and wipe from the inner corner of your baby's eye outward. If you use cotton balls, use a new one for each eye. Then wash your baby's face and outer ears with clean, warm water. Next, wash and rinse the neck, stomach, arms, legs, and abdomen. Lean your baby over to wash and rinse the back and buttocks, taking care to support the head and neck. Then you'll wash and rinse the genital area. Now it is time to wash the head and scalp. Wrap your baby in a towel and place him in a football hold. With your other hand, carefully wash your baby's head, using clean water and mild shampoo. Once you have worked up a lather, rinse the shampoo. Gently pat his head dry with a towel and brush or comb the scalp. Pat your baby dry with a towel. Then diaper and dress. Tummy time. It is important that your baby have some supervised tummy time each day while he is awake. This helps your baby develop upper body strength and coordination. Talk to your healthcare provider about how often and for what duration your baby should be on his tummy each day. Shaken baby syndrome.
Shaken baby syndrome occurs when a baby or toddler is shaken vigorously. Aggravated parents, babysitters, family members, or family friends are people who are most likely to shake a baby. The common trait among those who have shaken a baby is that they never believe themselves capable of harming a baby. For most, shaking a baby was an instantaneous reaction to frustration. Most of them never knew the dangers of shaking a baby. Shaking a baby is a serious form of child abuse. Babies and toddlers' heads are the largest part of their bodies. Their neck muscles are not strong enough to fully support their heads if they are shaken. When babies and toddlers are shaken, their brains collide with their skulls. Babies and toddlers' brains are growing and can easily be injured. Also, blood vessels surrounding the brain can tear easily during a shaking episode. One shaking episode can result in death, brain damage, spinal cord injury, broken bones, dislocations, and eye injuries. Immediate signs of shaking are breathing difficulties or respiratory arrest, extreme irritability, seizures, floppy arms and legs or stiff abnormal movements of the body, decreased level of awareness and alertness, poor feeding due to inability to suck or swallow, vomiting, bulging of the soft spot of the head, inability of the eyes to follow movement or focus, eyes have different pupil size, cardiac arrest, and death. Long-term consequences of shaking are death. 1 out of 4 babies and toddlers who are shaken dies as a result. Brain damage leading to mental retardation, speech and learning disabilities, paralysis, cerebral palsy, seizures, hearing loss, partial or total blindness, behavior disorders, or cognitive impairment. Research shows that crying is the behavior that most often precipitates a baby shaking. Caring for a baby can be difficult and frustrating. Babies cry for many reasons. Ask yourself the following questions. Does the baby need to be fed or burped? Does the baby's diaper need to be changed? Is the baby too hot or too cold? Does the baby seem to have a fever or be in pain from an earache, teething, rash, or an insect bite? Does the baby need to suck? Does the baby need to be held or soothed? Or is the baby overtired or overstimulated? If you have answered no to these questions and your baby is still crying, your baby might just need to cry. Discuss their crying patterns with your baby's doctor. Babies cry a lot in the first few months of life. If you are feeling frustrated, gently place your baby in the crib and go to another room for a few minutes until you calm down. Try the following. Take several deep breaths, count to 100, and sit until you're calm. Call a friend, a relative, or neighbor to talk about your frustrations or to see if someone can take over for a while. Do something for yourself. Listen to soft music, exercise, take a shower or a bath. Let your anger out in a safe way. Scrub the floors, do the dishes or the laundry, or have a good cry. It's okay to feel frustrated as long as you don't take it out on a baby. Write down the 10 best things about yourself. Write down the 10 best things about your child. Join a parenting group. Make sure that everyone who cares for your child understands the dangers of shaking a baby. Ask if they know about shaken baby syndrome. Explain the relation between infant crying, caregiver frustration or anger, and shaken baby syndrome. Make sure they know never to shake a baby. Give them the number of an alternate caregiver who can help. If the baby or toddler is inconsolable, medical attention should be considered. Remember that crying doesn't hurt a baby. Shaking does. If you suspect or know that your baby has been shaken, get medical attention immediately.
Car seat safety. All new car seats sold in the United States have to meet federal safety standards. You can confirm that your new car seat meets these standards by the information contained on a label on the side of the car seat. Car seat labels, car seat manufacturer's instructions, and the car manufacturer's instructions all contain important information regarding the installation and use of your car seat. It is recommended that you use a new car seat. If you choose to use a car seat that has been used for another child, even an older sibling, check for safety recalls on your car seat. Check that all stickers are in place. Make sure the instruction manual is available, and check the expiration date on the car seat. If the car seat you are using has been involved in an automobile accident, it should not be used and needs to be replaced. Check for safety recalls on your car seat by calling the Auto Safety Hotline at 888-327-4236 or by looking on the National Highway Traffic Safety Administration website at nhtsa.gov. Register your car seat with the manufacturer so that you will be notified in case of a recall. Types of car seats. There are several types of car seats for infants, toddlers, and children with special health needs. Two types of car seats are used for healthy infants: infant-only seats and convertible seats. It is recommended that a child ride rear-facing until she reaches the upper weight limit or height limit of the seat. Infant-only seats can only be used for infants weighing up to approximately 25 or 35 pounds, depending on the model. Many models come with a detachable base that can be left in the car. The seat clicks and locks into the base to secure the seat and can be detached from the base when you want to remove it. The seat should always be locked securely into the base when you are in the car. Most infant-only seats have carrying handles. Consult your manufacturer's instructions for the proper handle position when traveling. Most infant-only seats have 3 or 5-point harnesses. Whenever your baby is in the infant-only seat, she should always be secured with the internal harness, whether or not she is in the car, to prevent her from falling out. The infant-only seat is typically small and portable, and sometimes comes as part of a stroller system. The second type of infant-appropriate car seat is a convertible car seat. They are called convertible car seats because they can be used both rear-facing and forward-facing. Convertible car seats are bigger than infant-only seats. Many convertible car seat models allow babies to ride rear-facing until the baby weighs 30 or even 35 pounds. In fact, the American Academy of Pediatrics recommends that children stay rear-facing in car seats until at least 2 years of age, and preferably until the rear-facing weight or height maximum of the car seat has been reached. This is because research indicates that toddlers are more than 5 times safer riding rear-facing in a car seat. Once your baby reaches the upper rear-facing weight or height limit of your car seat, turn it around so it is forward-facing. Once your child has outgrown a convertible car seat, she will use a booster seat. A booster seat is a car seat designed for children who have outgrown car seats and are not tall enough for safety belts. A booster seat raises a child up so the safety belt fits properly. All children under 8 years old should be placed in a booster seat, unless they are more than 4 feet 9 inches tall. For children with breathing conditions, muscle control conditions, or other healthcare needs, there are specialized medical car seats, car safety beds, and restraints available. If your child has special needs, a variety of child restraint options are available. Talk to your baby's doctor about your child's positioning and transportation needs. Installing your baby's car seat. Once you have selected the appropriate car seat for your child, you will need to install it. In order to properly protect your child, the car seat must be installed correctly. It is important that you read and follow the car seat manufacturer's instructions and the vehicle manufacturer's instructions. The middle position of the back seat is typically the safest position for your baby. This is because they are the farthest away from all points of impact that occurred during a car crash. Some center seats do not offer latch. In this case, car seats can be installed safely with seat belts. Always consult the car manufacturer's instructions when installing a car seat. If the center position cannot be used, then use a side position in the back seat. Some vehicles also have side airbags to improve safety for adults in side impact crashes. However, children who are seated near certain types of side airbags can be at risk for severe injury. Read your vehicle owner's manual for recommendations that apply to your vehicle. Babies must ride sitting in a semi-reclined position, a 30 to 45 degree angle from vertical. Some seats come with angle adjusters and angle indicators to assist in making sure that the seat has been installed at the correct angle. The vehicle must be on level ground for these to work correctly. Read the manual to be sure you understand how your particular angle indicator works. To do its job, the car seat should not move more than an inch side to side or front to back. If the lap part of the safety belt is not tight or the car seat slides around on the vehicle seat, the child might not be protected. A car seat must be installed tightly against the vehicle seat back. To make car seat safety installation safer and easier, child safety experts have created the latch system. Latch, otherwise known as lower anchors and tethers for children, is required on most car seats and vehicles manufactured after September 1, 2002. Latch-equipped vehicles have at least two sets of small bars called anchors, located in at least two passenger seating positions where the cushions meet. Latch-equipped child safety seats have a lower set of attachments that fasten or hook to these vehicle anchors. Most forward-facing car seats also have a top strap that attaches to the top tether anchor in the vehicle. Together, the anchors and the car seat attachments make up the latch system. Check your vehicle manual for locations of the latch anchors. Some vehicles do not have latch in the center. If a car or car seat is not latch-equipped, the car seat must be installed using a seat belt. Many car seats come equipped with both seatbelt and latch installation capabilities. Car seats can be installed safely and securely with seatbelts or with latch. Make sure that you do not use both latch and seatbelts to install your car seat. You must use one or the other. More than 80% of all parents use or install car seats incorrectly. It is highly recommended that you ask a certified child passenger safety technician to assist you with the installation of your car seat. A list of certified technicians is available by state or zip code on the National Highway Traffic Safety Administration website at nhtsa.gov. A list of inspection sites is available at seatcheck.org. You may also call the NHTSA Auto Safety Hotline at 888-327-4236 or 866-SEAT-CHECK. Please take the time to have a professional check that your child's car seat is properly installed. Buckling baby in the car seat. In addition to having your child's car seat installed correctly, you will need to make sure that you correctly buckle your child into the car seat. For a rear-facing infant in either an infant-only seat or a convertible seat, always install the harness straps through the slots at or below the baby's shoulders. For a newborn infant, you will most likely use the lowest harness slots. Harness straps must fit properly on the baby's shoulders and between her legs. They must be very snug and very flat on your baby's shoulders. A simple test can be done by attempting to pinch the belt fabric off the top of your baby's shoulders. If you can easily pinch up the fabric, you need to tighten the harness. Place the plastic harness retainer clip level to your child's armpits in order to hold the harness straps on the shoulders and to provide upper body protection. Check instructions if the car seat does not have a harness clip. If your baby needs support, fill empty spaces with small, rolled blankets on each side of your baby's shoulders and head. Never place blankets, pillows, or anything else underneath your baby. When your baby begins to ride forward-facing, make sure that the harness straps are installed through the slots that are at or above your child's shoulders. Most convertible car seats require the use of the topmost slots for the forward-facing position. These slots are reinforced to prevent the seat from failing in a crash. Again, it is important to check the car seat's labels, car seat manufacturer's instructions, and the car manufacturer's instructions for correct installation, height and weight restrictions, and the best and safest placement of the harness straps. Make sure to follow the instructions specific to the type of car seat you are using for your child. Check for any safety recalls. And have a certified child passenger safety technician inspect the installation of your child's car seat. Sleep safety. When you put your baby down to sleep, place him on his back every time. Studies have shown increased incidence of sudden infant death syndrome, also known as SIDS, in infants who sleep on their stomachs. Since the American Academy of Pediatrics started the Back to Sleep campaign in 1994, cases of SIDS have gone down approximately 50%. In addition to placing babies on their backs to sleep, you should also do the following to help reduce the risk of SIDS. Remove blankets, quilts, pillows, toys, or anything else in the crib before placing your baby in it. Many organizations, including the American Academy of Pediatrics and the Consumer Product Safety Commission, caution against the use of crib bumper pads. Just like a pillow or thick blanket, crib bumper pads can restrict a baby's breathing if the bumper is next to the baby's nose or mouth. Remove crib bumper pads from your crib. Always make sure your baby sleeps on a firm mattress, made especially for a crib or bassinet. Never use a pillow, waterbed, adult bed, couch, sheepskin, comforter, or other soft surface. Use fitted sheets, especially made for the crib or bassinet, which for safety reasons should fit tightly. Make sure your baby does not get too warm. He should not feel sweaty or hot to the touch. Keep the room at a temperature that feels comfortable to an adult in a short-sleeved shirt. If you are concerned that your baby might get cold, use a blanket sleeper instead of a blanket. Research indicates an association between pacifier use and a reduced risk of SIDS, so the American Academy of Pediatrics recommends the use of pacifiers at nap time and bedtime throughout the first year of life. It is recommended that pacifier introduction for breastfed infants be delayed until 1 month of age to ensure that breastfeeding is firmly established. If the pacifier falls out of your baby's mouth during sleep, don't replace it. Also, don't force the pacifier if your baby refuses it. Swaddling has been shown to be beneficial for babies, especially preterm babies. Swaddling can result in longer periods of sleep and reduce the amount of time your baby cries. Swaddling can also help to support babies' neurological development. Should you choose to swaddle your baby, safe swaddles have been developed that prevent your baby from breaking out of the swaddle. Breaking out of the swaddle would result in a loose blanket that is a risk for sudden infant death syndrome. Bed sharing is not recommended during sleep. Infants may be brought into the bed for nursing or comforting, but should be returned to their own crib or bassinet when the parent is ready to return to sleep. Do not allow your baby to be exposed to secondhand smoke. In fact, do not allow smoking in your home. Secondhand smoke increases the risk of SIDS. If you must smoke, do so outside and away from your baby. Studies show that using a low-speed ceiling fan in addition to placing your baby on their back can further help reduce the risk of SIDS. Tell everyone who cares for your baby, including grandparents, friends, and babysitters, to place your baby on his back every time he goes to sleep. The recommendation that babies sleep on their backs may not apply to babies who have certain medical conditions. Your baby's doctor can advise you on which position is best for your baby. Crib safety. Cribs are federally regulated for safety. If you buy a new crib in the United States, it will meet federal safety guidelines. Buying a new crib ensures that the model hasn't been recalled or damaged. If you are using a crib that is not new, even if you bought it new for your baby's older brother or sister, it is recommended that you check the Consumer Product Safety Commission's website, cpsc.gov, to make sure that the crib has not been recalled. Whether your crib is new or used, make sure you have all the pieces that come with the crib, as well as the owner's manual. Begin by reading the manual. Once you have assembled the crib, and prior to placing the mattress in the crib, make sure there are no missing, loose, broken, or improperly installed screws, brackets, or other hardware on the crib or mattress support. Next, remove any plastic wrapping from the mattress. You must use a firm mattress that fits tightly into the crib so that baby cannot get trapped between the mattress and the crib. Crib sizes and mattress sizes are federally regulated. However, if you have an older crib, make sure that you cannot even put 2 fingers between the mattress and the crib. If you can put 2 fingers between the mattress and the crib, your baby's head or nose could get stuck and result in suffocation. Make sure that the slats are no more than 2 3/8 inches apart so that your baby's body cannot fit through the slats. The crib should not have corner posts higher than 1/16 of an inch so a baby's clothing cannot catch. Avoid cutouts in the headboard or footboard so a baby's head or other body parts cannot get trapped. A crib built before 1978 may contain lead paint, which can cause lead poisoning if your baby chews on it. Lead paint can pose serious health risks and developmental delays if even so much as a flake is ingested. Make sure that the crib you are using does not contain lead paint. Cribs built until mid-2009 are typically drop-side cribs. In 2009, drop-side cribs were banned from sale in the U.S. because there were incidents of the side rail separating from the crib and posing a strangulation hazard. It is recommended that you do not use a drop-side crib. Some parents choose to use a bassinet rather than a crib during the child's first few months. If you use a bassinet, make sure the mattress is firm and fits tightly into the bassinet. Use a sheet specifically for the bassinet mattress. Bassinets are typically portable, which makes them easy to move from room to room. Make sure to read the manufacturer's guidelines on weight and stop using the bassinet before your baby reaches the maximum weight. And be wary of using a bassinet if you have other children or pets. Home safety. Once you and your baby come home from the hospital, you will probably spend a lot of time at home playing, eating, and sleeping. Even though your baby won't be mobile when you bring him home from the hospital, it is never too early to start baby-proofing. Your home needs to be a safe place for your baby, especially as she becomes more mobile over the coming months. In this section, we'll review some ways to make your home as safe as possible for your family. However, it is important to remember that the ideas presented in this program should help you begin the process of baby-proofing. It is not possible to create an exhaustive or a complete baby-proofing checklist because each home is different with its own unique potential hazards. Identify the potential hazards in your home and correct them. You should start by creating a list of emergency phone numbers and place a copy of this list by every phone in your home. The list should include 911, or the emergency number in your area that can be used to dispatch police, fire, or ambulance. The Poison Control Center, physician contact numbers, parents' work and cell phone numbers, neighbors' phone numbers, and any other emergency contact numbers you want to include. Pre-program your phones if possible, and make sure your caregivers know where the phone number list is. In addition to a list of emergency phone numbers, you should create an emergency kit. Your kit should include a bulb syringe to clean mucus from your baby's nose, a thermometer, alcohol wipes to clean the thermometer, infant acetaminophen, such as Tylenol for treating fever or pain, Pedialyte, a balanced solution of water and minerals that is given to babies suffering from vomiting and diarrhea, and an antihistamine, such as Benadryl, for treating allergic reactions. Consult your baby's doctor before administering infant acetaminophen, Benadryl, or any other medication. Always make sure that your caregivers know where the emergency kit is located, and be sure that medicine is always locked away out of the reach of children. Make sure that you and your baby's caregivers have taken a class to learn infant cardiopulmonary resuscitation, also known as CPR. Ask your hospital if they teach infant CPR. If not, contact the American Heart Association or your local fire department to find a class in your area. For the health and safety of your family, take precautions to prevent fires and provide early detection in case of a fire. Place smoke detectors in the hallway outside sleeping areas, inside each bedroom, as well as on each story of your home, including basement and furnace areas. Additionally, you should test your smoke detectors weekly. Replace smoke detector batteries regularly and clean the detector according to manufacturer's instructions. Check for and remove fire hazards such as frayed wires, appliances that overheat, and overloaded sockets. Keep fire extinguishers throughout the house. Make sure to have one in the kitchen. Have an escape plan for your home in case of a fire. Conduct drills to practice the escape plan. Contact your local fire department for additional information regarding fire prevention and what to do in case of a fire. Another potential threat to your family is carbon monoxide, a colorless and odorless gas that can cause severe illness and even death if large amounts are inhaled. Infants are especially susceptible to carbon monoxide poisoning. Take precautions to prevent carbon monoxide poisoning. Check sources of carbon monoxide regularly. Have professional inspections annually of heating systems, chimneys, and flues, which are some of the sources of carbon monoxide in the home. If you have anything in your home that could potentially emit carbon monoxide, be sure that you install carbon monoxide detectors throughout your home and in each bedroom. Homes built before 1978 may contain lead paint. If your home was built before 1978, and if paint is chipped or peeling, or if you're planning a renovation, have your home checked for lead paint. If babies or children eat or inhale lead paint chips or even dust containing lead, they can become very ill. Lead poisoning can cause mental and physical development issues, including mental retardation. Professional lead inspectors and lead removers can remove or cover lead paint. Next, we'll review some baby-proofing basics. You should start by walking through your home and writing down potential hazards. Once completed, repeat this process a second time, this time crawling, so you'll be able to identify potential dangers from your baby's point of view. Address all of the hazards you have identified. Once your baby starts spending time on the floor, you'll want to check your floors throughout the day from your baby's perspective, especially if you have other children or pets, so that you can remove small objects that could be swallowed. Objects such as coins, small toys, and dropped food can be choking hazards. Keep floors clean and vacuumed. Install safety locks on all cabinets and drawers within a child's reach that contain anything that could be a potential risk. Even if you do put locks on cabinets, be sure to move cleaners, laundry supplies, medicine, pesticides, and other poisonous substances to high shelves and cabinets as an added precaution. Please, check all of the cabinets and drawers in your home for items that could harm your child. Keep small, sharp, or otherwise dangerous items off countertops that can be reached by children. You should install knobs that prevent your child from accidentally lighting the stove. Additionally, use a stove guard to prevent your child from reaching up and grabbing a hot pot or touching a hot stove. If possible, keep your garbage behind a door. If that is not an option, make sure that your garbage has a tight, secure lid that your child cannot remove. To protect your family from being scalded by hot water, adjust the temperature on your hot water heater to 120 degrees Fahrenheit. Make sure to keep purses out of reach from baby. Purses often contain many things that can cause a baby to choke or be poisoned, including coins, medication, and lipstick tubes. You'll also need to keep plastic bags out of your child's reach. Plastic bags can cause suffocation. Use doorknob handle covers that will only open the door if it is squeezed and turned at the same time. Place these on rooms that are off limits for your toddler, such as the bathroom. Remember, these are only useful if the door is closed. You may also choose to lock the door. Babies can drown in toilet bowls. Toilet latches can be used to prevent the baby from lifting the lid of the toilet. Remember to keep the bathroom door closed. You'll need to check all of the window coverings in your home to ensure that they do not pose a strangulation risk to your child. Move all cribs, beds, furniture, and toys away from windows and window cords, preferably to another wall. Also, make sure to keep windows locked and install window guards on floors above the first floor. Keep all window pull cords and inner lift cords out of reach of children. Make sure that tasseled pull cords are short, that continuous loop cords are permanently anchored to the floor or wall, and that cord stops are properly installed and adjusted to limit movement. Lock cords into position whenever horizontal blinds or shades are lowered. If possible, install cordless window coverings in children's bedrooms and play areas. Some older blinds have looped pull cords, which can be dangerous. If your blinds have looped pull cords, cut the looped pull cord just above the tassel and remove the buckle, if any. Insert the cord through the tassel and tie cord ends to secure the tassel. The Window Covering Safety Council strongly recommends replacing window coverings purchased before 2001 with today's safer products. However, if you prefer to keep them, the Window Covering Safety Council will send a kit to retrofit your window coverings at no charge. To order a kit, call 800-506-4636 or visit their website at windowcoverings.org. You'll need to cover electrical outlets. Outlet covers must be placed securely in the outlet so the babies can't pull them out and place them in their mouths. Keep toys with long strings or cords away from babies and young children. A cord can become wrapped around a baby's neck and cause strangulation. You should examine all of your furniture. Make sure to cover furniture corners and fireplace edges with padding. Secure items that could potentially be pulled over by baby, such as bookshelves and entertainment centers. anchor them to the wall if possible. Make sure that unlocked drawers cannot be pulled all the way out and fall onto your child. Secure tablecloths to the table or remove them altogether so that children cannot pull the tablecloth and anything on the table onto themselves. Make sure that cords for televisions, stereos, DVD players, and other equipment are shortened and are not a strangulation hazard. Also, be sure the equipment will not tip over if the cords are grabbed. Use child safety gates at the top and bottom of all staircases, and make sure they are correctly installed. Ideally, use gates that are bolted to the wall. Some portable gates can be dislodged. If the gaps in the post supporting your banister are more than 2 3/8 inches wide, install a wider banister barrier so that baby cannot get stuck in the supports. You'll need to be aware of what plants are in your home. There are hundreds of household plants that are poisonous when eaten. Your local poison control center can tell you whether a plant in your home is poisonous. It is advisable to dispose of plants that can pose a threat to your child's safety. Baby proofing is an ongoing process as your child grows, so stay vigilant about keeping your home safe, as well as any other home where baby will be spending time. Each home is unique and has its own set of potential hazards that need to be addressed. Remember, there is no substitute for adult supervision. Supervise your baby while she is awake. If you need to step away, place baby in a safe place, such as the crib. Involution of the uterus. Your body went through many changes during pregnancy. In the postpartum period, your body adjusts, physically and psychologically, to the birthing process. The postpartum period begins immediately after delivery. It continues for about 6 weeks or until your body has completed its adjustment and has nearly returned to a pre-pregnant state. Your doctor will check to see that your uterus has returned to its non-pregnant size and location, and that any perineum tearing or incision has healed properly. The process of your uterus returning to its non-pregnant size is called involution of the uterus. At birth, the uterus weighs about 2 pounds and is about the size of a cantaloupe. Over the next 6 weeks, it will contract until it reaches a non-pregnancy size of about 2 ounces, which is about the size of a pear. About 10 days after your baby is born, you will no longer be able to feel the top of your uterus in your abdomen. The process of involution may cause you to feel some pain in the form of contractions, especially during feeding, if you breastfeed. These contractions are normal and are a sign that your uterus is returning to its non-pregnant size. Lochia. During the first 4 to 6 weeks after giving birth, you will have a discharge called lochia. Lochia is similar to a heavy menstrual flow. The discharge will change from red to pinkish, to yellow to whitish-brown, and will increase with activity or breastfeeding. Lochia may be heavier when you get out of bed because gravity lets the blood pool into the vagina. However, it is important to call your doctor if you experience heavy and persistent bleeding, more than 1 pad per hour, if there is a foul odor to the discharge, or if you pass a clot greater than the size of a plum. Do not use tampons until your doctor tells you it is safe to do so. Menstruation. You may get your menstrual period 3 to 8 weeks after your baby's birth, or it may be delayed for 6 months or more if you are breastfeeding. It is important to remember that you will ovulate before you get your period, and you may ovulate without later having a period. If you want to take precautions against pregnancy, ask your doctor about birth control. Your first period may be much heavier than normal, but your second period should be closer to normal. Bladder and bowel function. After delivery, you should get up and walk around as soon as your doctor tells you it is okay to do so. Moving around lessens the risk of blood clots and helps establish bladder and bowel function. It is important to try and urinate frequently after delivery. Your body will be getting rid of excess fluid that caused hand and leg swelling late in pregnancy. Consequently, you will eliminate large amounts of urine during the first few days after delivery. It is also important to establish regular bowel habits after delivery. The first bowel movement should occur within 2 to 3 days after delivery. Drinking at least 8 glasses of fluid a day and eating roughage such as fresh fruits, vegetables, or whole grain breads can help to establish regular bowel movements. If prescribed by your doctor, you may use laxatives or stool softeners. If you are breastfeeding, consult your baby's doctor before taking any medication. Hemorrhoid care. Hemorrhoids commonly develop either during pregnancy or after delivery. Hemorrhoids are swollen veins that appear either inside or outside the rectum. Fortunately, hemorrhoids usually shrink or disappear altogether within a few weeks after delivery. To help ease discomfort, try taking a sitz bath or soaking in clean, warm water several times a day. You may also try placing an ice pack on the rectum. Constipation can aggravate hemorrhoids, so your doctor may recommend using a stool softener. If you are breastfeeding, consult your baby's doctor before taking any medication. Episiotomy care. If you had an episiotomy, use topical medications or other ointments as ordered by your doctor. If burning, a rash, or irritation develop after using any topical medication, discontinue using it and call your doctor immediately. It is important to keep the vaginal area clean and dry. Change sanitary pads often to absorb discharge and clean the area several times a day and after going to the bathroom. You may use a squeeze bottle, often referred to as a peri bottle, filled with warm water, or you may use a sitz bath. When cleaning, rinse the area, blot with tissue from front to back, and apply a clean pad. Wash your hands thoroughly before and after cleaning the vaginal area. Do not touch your stitches. They will dissolve on their own and will not need to be removed by your doctor. The swelling of the labia should subside in approximately 2 weeks. Cesarean incision care. If you had a cesarean delivery, keep your incision clean and dry at all times. Try to prevent clothing from rubbing your incision and avoid touching it until it is completely healed. Inspect your incision daily for drainage or separation. If you detect either of these, call your doctor. Do not apply lotions or oils to the incision line until it is completely closed and healed. Bathing. Showers are usually safe as soon as you can walk after cesarean sections and vaginal deliveries. Talk to your doctor to determine when to begin bathing in a tub. Breast care. In the first few days after your baby is born, your breast can become hard, warm to the touch, tender, and swollen. This is often referred to as engorgement. You can treat engorgement in a number of ways. If you are breastfeeding, wear a support bra day and night. You may remove the bra during feedings. Feed your baby often. Apply cold compresses between feedings to reduce swelling. Apply warm compresses before feedings to encourage the flow of milk. Gently massage your breast and try relaxation techniques to help improve milk flow and reduce engorgement. Ask your doctor about using over-the-counter medications such as ibuprofen. If you develop a fever or severe pain, call your doctor to rule out a breast infection. If you are bottle feeding, wear a support bra day and night. Avoid breast stimulation. Apply cold compresses as needed to reduce swelling and pain. Ask your doctor about using over-the-counter medications such as ibuprofen. If you develop a fever or severe pain, call your doctor to rule out a breast infection. Limitations after delivery. After delivery, your body needs time to heal. There are some limitations that should be observed. If you had a vaginal delivery, avoid heavy lifting. If you had a cesarean delivery, do not lift anything heavier than your baby for at least 2 weeks, or until your doctor tells you it is safe. Talk with your doctor about the appropriate time to resume exercise. Do not drive until your doctor tells you it is safe. Never drive while taking narcotic pain medication. If you had a cesarean delivery, limit stair climbing to necessary trips for the first 2 weeks. Sleep when your baby sleeps and rest as much as possible. Check with your doctor before resuming sexual intercourse. Causes for concern. Notify your doctor if you experience any of the following: an oral temperature of 100.4 degrees Fahrenheit or higher, increased pain in the abdomen or perineum, increased pain, swelling, redness, or discharge from the episiotomy or cesarean incision, soaking through more than 1 sanitary pad per hour, foul-smelling discharge, clots that are plum-sized or larger, tender, warm, reddened breast, cracked, bleeding nipples, burning when urinating or feeling unable to completely empty the bladder, leg tenderness or redness, or any other unusual problems. Developmental milestones. Knowing how to interact with your baby at each stage of their development maximizes their learning experiences. The following sections provide some brief guidelines on how to interact with your baby during the first 2 years. Remember, these are guidelines, and every baby develops at his or her own pace. If you have any questions about the development of your baby, please consult your pediatrician. Birth to 3 months. From birth to about 3 months, babies may appear to be using peripheral vision much of the time. It might look like your baby is looking at you out of the corner of his eye. This is normal. Your face should be no farther than 12 to 18 inches from your baby's face so that he can see you clearly. Babies like to look at your facial expressions, especially if they are exaggerated. For example, widen your eyes or exaggerate opening and closing your mouth when you talk. You can shift your face slowly from side to side, encouraging baby's gaze to follow you horizontally back and forth. Use the inflection of your voice to catch baby's attention. Sing and talk to your newborn often. Your baby's hearing is almost fully developed by the time he is born. Babies quiet to their mother's voice very soon after birth. Your baby can distinguish your voice and discern different rhythms, sounds, and pitches. Your baby may coo and gurgle in response to what he is hearing. Listening to your voice will help your baby develop his language skills, even if it is just telling him about what you are doing throughout the day. Your baby communicates by using facial expressions. When you see your baby after nap time or after you return from work or an errand, show your excitement by smiling and giving her a hug and a kiss. By 8 to 12 weeks of age, your baby should smile back at you and show her excitement.
Hello, I'm Dr. Alan Rosenblatt, specialist in neurodevelopmental pediatrics. Babies develop control over their muscles in a very methodical progression, starting with their head and neck, and by the end of the first year, all the way down to their toes. An important communication tool that your baby will use throughout the first year is body language. Important milestones during this period of development include smiling socially in response to a person, cooing or making vowel sounds, gazing in horizontal, vertical, and circular directions. If your baby is not doing these things by the age of 4 months, consult your pediatrician. You should use the routine activities of your daily interactions with your baby as prime opportunities for playing games, singing songs, and talking to him. Feeding, diapering, or putting baby to sleep are all opportunities for quality, interactive play, stimulation, or soothing.
3 to 6 months. Around 3 months of age, your infant's vision will be almost fully developed. He will have the ability to see in color and will typically prefer to look in front of him. He can see to distances of up to 12 feet. Your baby can also turn and lift her head, but it's still very important to support her neck at all times. Your baby can follow objects with his eyes. Try moving your hands in a big circle. Babies at this age will love to watch you move your hands and make different facial expressions.
At this stage, your baby can also recognize her hands and feet. She will stare at her hands and fingers and even lift her head to see and grasp her feet. She can voluntarily hold a toy and will reach and grasp for different things. Your baby will begin to transfer an object from one hand to another. Bring more movement into your play with your baby. Row their arms, move their toes and feet. Other important milestones during this phase of development include no head lag when pulled to sitting from lying on her back, rolls over from stomach to back and back to stomach, sits with support, uses reciprocal vocalizations or talks back and forth, laughs out loud, razzes, turns her head in the direction of sound. If your baby does not do these things by the age of 7 months, consult your pediatrician.
6 to 12 months. Around 6 months of age, your baby will probably be able to sit up with support, and by 7 months, without support. Her balance will continually be improving. During this period of development, most babies will start crawling, pull to stand, and walk, holding on to furniture. Remember, these are guidelines, and every baby develops at his or her own pace. At this stage, your baby is better able to distinguish sounds. Hearing the same sounds repeatedly helps baby identify them, and he may potentially repeat a few isolated syllables or words. Around 6 months of age, your baby will start adding consonants to the vowel sounds she is making. Your baby may be able to say 1 or 2 words purposefully by 12 months of age. Repetition helps your baby learn language and may explain why babies love songs and rhymes. Rhymes help babies build their vocabulary of sounds.
Your baby is learning hand-eye coordination and developing fine motor skills. They start using the pincer grasp, which enables them to pick up small objects using 2 or 3 fingers. Object permanence is another skill your baby is learning. Playing games like peekaboo and hiding a toy under a blanket are ways to teach him that things do not disappear just because they are out of sight. By the end of your baby's first year, the concept of object permanence should be well established so that when an object falls off the table, the baby looks to see where it fell. Your baby will start to imitate your movements and expressions, like clapping his hands when you clap yours. Language development proceeds from babbling, combining vowels and consonants, to the use of gestures and his first words. Your baby will respond consistently to his name, understand no, and display a sense of humor. If your baby does not do these things by the age of 12 months, consult your pediatrician.
1 to 2 years. By your baby's first birthday, she will be able to communicate with you using gestures, facial expressions, sounds, and maybe some words. She will begin walking during this period. and using her hands and fingers to explore objects in more complex ways. Your baby will go from imitating things you do to using her own imagination. Your toddler learns through repetition. She might want you to repeat her favorite song and read her favorite book over and over again. Repetition helps her feel in control of her environment because she's able to anticipate the outcome of your actions.
At this stage, your baby's memory is well developed, and they have the ability to repeat what you show them. So teaching your baby new songs and movements is very important. From 12 to 18 months of age, your toddler should be talking using single words, but adding continually to her vocabulary. She should be sharing with you items of interest that she feels are fascinating. She should be walking, but still falls quite frequently. At this stage, children also start using a cup and spoon.
Between 18 and 24 months, the toddler starts combining two words into a sentence, like more milk. He should be able to clearly communicate his needs. If your toddler says many words and can label objects but does not use those words purposefully to express his needs, this should be brought to your pediatrician's attention. This is the stage when toddlers demonstrate pretend play, having pretend tea parties, pretend trips, and pretend adventures. He develops more stability on his feet and runs, starts to jump with both feet off the ground, and walks up and down the stairs holding onto a railing or the hand of an adult. If your child should lose milestones that were previously mastered, things that he could easily do before but no longer seems able to, your pediatrician should be notified immediately.
The wheels on the bus go round and round, round and round, round and round. The wheels on the bus go round and round, all through the town. The doors on the bus go open and shut, open and shut, open and shut. The doors on the bus go open and shut, all through the town. The wipers on the bus go swish, 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 swish. The wipers on the bus go swish, 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 all through the town. The horn on the bus goes beep, 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 beep. The horn on the bus goes beep, 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 all through the town. The people on the bus go up and down, up and down, up and down. The people on the bus go up and down, all through the town. The people on the bus say, I love you, I love you, I love you. The people on the bus say, I love you, all through the town. Row, row, row your boat gently down the stream. Merrily, 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 life is but a dream. Rock, rock, rock your boat gently side by side. Merrily, 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 let's go for a ride. Bounce, bounce, bounce your boat gently up and down. Merrily, 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 let's go to the town. Row, row, row your boat gently down the stream. Merrily, 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 life is but a dream. Rock, rock, rock your boat gently side by side. Merrily, 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 let's go for a ride. Bounce, bounce, bounce your boat gently up and down. Merrily, 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 let's go to the town. Trot, trot to Boston to buy a pancake. When we got there, there wasn't one baked. So we came galloping home, galloping home. Trot, trot to Boston to buy a pancake. When we got there, there wasn't one baked. So we came galloping home, galloping home. Trot, trot to Boston to buy a pancake. When we got there, there wasn't one baked. So we came galloping home, galloping home. Hickory dickory dock, the mouse ran up the clock. The clock struck one, the mouse ran down. Hickory dickory dock, Hickory dickory dock, the mouse ran up the clock. The clock struck 2, the mouse ran down. Hickory dickory dock, hickory dickory dock, the mouse ran up the clock. The clock struck 3, the mouse ran down. Hickory dickory dock, hickory dickory dock, the mouse ran up the clock. The clock struck 1, the mouse ran down. Hickory dickory dock, hickory dickory dock, the mouse ran up the clock. The clock struck 2, the mouse ran down. Hickory dickory dock, hickory dickory dock, the mouse ran up the clock. The clock struck 3, the mouse ran down. Hickory dickory dock. Going for a ride in an elevator, going for a ride in an elevator. First floor, second floor, third floor, down. Going for a ride in an elevator, going for a ride in an elevator. First floor, second floor, third floor, down. Going for a ride in an elevator, going for a ride in an elevator. First floor, second floor, third floor, down. Here comes the choo-choo train chugging down the track. Now it's moving forward, now it's moving back. Now the bell is ringing, now the whistle blows. What a lot of noise it makes everywhere it goes. Here comes the choo-choo train chugging down the track. Now it's moving forward, now it's moving back. Now the bell is ringing, now the whistle blows. What a lot of noise it makes everywhere it goes. If you're happy and you know it, clap your hands. If you're happy and you know it, clap your hands. If you're happy and you know it and you really want to show it. If you're happy and you know it, clap your hands. If you're happy and you know it, stomp your feet. If you're happy and you know it, stomp your feet. If you're happy and you know it and you really want to show it. If you're happy and you know it, stomp your feet. If you're happy and you know it, shout hooray, hooray. If you're happy and you know it, shout hooray, hooray. If you're happy and you know it and you really want to show it. If you're happy and you know it, shout hooray, hooray. If you're happy and you know it, clap your hands. If you're happy and you know it, clap your hands. If you're happy and you know it and you really want to show it. If you're happy and you know it, clap your hands. If you're happy and you know it, stomp your feet. If you're happy and you know it, stomp your feet. If you're happy and you know it and you really want to show it. If you're happy and you know it, stomp your feet. If you're happy and you know it, shout hooray, hooray. If you're happy and you know it, shout hooray, hooray. If you're happy and you know it and you really want to show it. If you're happy and you know it, shout hooray, hooray. Where is baby? Where is baby? Where, oh where? Where, oh where? Peekaboo, I see you. Peekaboo, I see you. Hiding there, hiding there. Where is baby? Where is baby? Where, oh where? Where, oh where? Peekaboo, I see you. Peekaboo, I see you. Hiding there, hiding there. 3 little apples hanging from a tree. Teasing Mr. Alligator, can't catch me. Along came Mr. Alligator, mouth open wide. Snap goes the apple deep inside. 2 little apples hanging from a tree. Teasing Mr. Alligator, can't catch me. Along came Mr. Alligator, mouth open wide. Snap goes the apple deep inside. 1 little apple hanging from a tree. Teasing Mr. Alligator, can't catch me. Along came Mr. Alligator, mouth open wide. Snap goes the apple deep inside. a tree. Teasing Mr. Alligator, can't catch me. Along came Mr. Alligator, mouth open wide. Snap goes the apple deep inside. Two little apples hanging from a tree. Teasing Mr. Alligator, can't catch me. Along came Mr. Alligator, mouth open wide. Snap goes the apple deep inside. One little apple hanging from a tree. Teasing Mr. Alligator, can't catch me. Along came Mr. Alligator, mouth open wide. Snap goes the apple deep inside. Here we go, Looby-Loo. Here we go, Looby-Light. Here we go, Looby-Loo. All on a Saturday night. I put my right hand in. I take my right hand out. I give my hand a shake, 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 and turn myself about. I put my left hand in. I take my left hand out. I give my hand a shake, 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 and turn myself about. I put my right foot in. I take my right foot out. I give my foot a shake, 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 and turn myself about. I put my left foot in. I take my left foot out. I give my foot a shake, 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 and turn myself about. I put my whole self in. I take my whole self out. I give myself a shake, 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 and turn myself about. The noble Duke of York, he had 10,000 men. He marched them up to the top of the hill, and he marched them down again. And when they were up, they were up. And when they were down, they were down. And when they were only halfway up, they were neither up nor down. Roll them to your left, roll them to your right. Roll your baby all around, what a funny sight. The noble Duke of York, he had 10,000 men. He marched them up to the top of the hill, he marched them down again. And when they were up, they were up. And when they were down, they were down. And when they were only halfway up, they were neither up nor down. Roll them to your left, roll them to your right. Roll your baby all around, what a funny sight. Tony Chestnut knows I love you. That's what Tony knows. Tony Chestnut knows I love you. That's what Tony knows. Tony Chestnut knows I love you. That's what Tony knows. Head, shoulders, knees and toes, knees and toes. Head, shoulders, knees and toes, knees and toes. Eyes and ears and mouth and nose. Head, shoulders, knees and toes, knees and toes. Head, shoulders, knees and toes, knees and toes. Head, shoulders, knees and toes, knees and toes. Eyes and ears and mouth and nose. Head, shoulders, knees and toes, knees and toes. 1 little, 2 little, 3 little toes. 4 little, 5 little, 6 little toes. 7 little, 8 little, 9 little toes. 10 little toes on my feet. 1 little, 2 little, 3 little fingers. 4 little, 5 little, 6 little fingers. 7 little, 8 little, 9 little fingers. 10 little fingers on my hands. 1 little, 2 little, 3 little toes. 4 little, 5 little, 6 little toes. 7 little, 8 little, 9 little toes. 10 little toes on my feet. 1 little, 2 little, 3 little fingers. 4 little, 5 little, 6 little fingers. 7 little, 8 little, 9 little fingers. 10 little fingers on my hands. There was 1, there were 2, there were 3 little fingers. There were 4, there were 5, there were 6 little fingers. There were 7, there were 8, there were 9 little fingers. 10 little fingers on my hands. They can dance, they can dance, they can dance everywhere. They can snap, they can snap, they can tickle, they can tickle, they can tickle everywhere. They can tickle, they can tickle, they can tickle everywhere. They can tickle, they can tickle, they can tickle everywhere. 10 little fingers on my hands. There was 1, there were 2, there were 3 little fingers. There were 4, there were 5, there were 6 little fingers. There were 7, there were 8, there were 9 little fingers. 10 little fingers on my hands. They can dance, they can dance, they can dance everywhere. They can snap, they can snap, they can snap everywhere. They can clap, they can clap, they can clap everywhere. 10 little fingers on my hands. They can tickle, they can tickle, they can tickle everywhere. They can tickle, they can tickle, they can tickle everywhere. They can tickle, they can tickle, they can tickle everywhere. 10 little fingers on my hands. The itsy bitsy spider crawled up the water spout. Down came the rain and washed the spider out. Out came the sun and dried up all the rain. And the itsy bitsy spider crawled up the spout again. The itsy bitsy spider crawled up the water spout. Down came the rain and washed the spider out. Out came the sun and dried up all the rain. And the itsy bitsy spider crawled up the spout again. Round and round the garden goes the teddy bear. 1 step, 2 step, tickle you under there. Round and round the garden goes the bumblebee. 1 buzz, 2 buzz, tickle you on the knee. The baby has a tiny little nose and tiny little toes, tiny little ears and tiny little ears, tiny little shins and tiny little chin, tiny little bum and tiny little tongue, tiny little eyes and tiny little thighs. That's what baby has. The baby has a tiny little nose and tiny little toes, tiny little ears and tiny little ears, tiny little shins and tiny little chin, tiny little bum and tiny little tongue, tiny little eyes and tiny little thighs. That's what baby has. Going to Boston, going to town. You better watch out or you might fall down. Going to Boston, going to town. You better watch out or you might fall down. Going to Boston, going to town. You better watch out or you might fall down. Twinkle, twinkle, little star, how I wonder what you are. Up above the world so high, like a diamond in the sky. Twinkle, twinkle, little star, how I wonder what you are. Twinkle, twinkle, little star, how I wonder what you are. Up above the world so high, like a diamond in the sky. Twinkle, twinkle, little star, how I wonder what you are. Adi, 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 adios. Adi up above and adi down below. Adi from your nose straight down to your toes. Adi, 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 adios. Adi, 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 adios. Adi up above and adi down below. Adi from your nose straight down to your toes. Adi, 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 adios. Adi, 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 adios. Adi up above and adi down below. Adi from your nose straight down to your toes. Adi, 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 adios.
Family support is very important to a new mother. Guidelines on safety and baby care have changed since the time that Grandma and Grandpa, or even an older sister, gave birth. For example, now babies are put on their back to sleep because it's much safer for babies to sleep on their backs. The incidence of sudden infant death syndrome have been reduced by 50% since the Back to Sleep campaign was introduced. Also, car seat safety has changed a lot. It is very important for a baby to be in their car seat every time they ride in the car. In fact, the American Academy of Pediatrics recommends that children sit rear-facing in a car seat until at least 2 years of age. And in recent years, many studies have shown the health benefits of breastfeeding. Breastfeeding reduces the risk of ear infections, respiratory infections, type 1 diabetes, obesity, diarrhea, infections, and allergies. Family support is critical for breastfeeding success and extended breastfeeding duration. Dads, partners, and grandmas play a key role in helping the new mother breastfeed. Today, the American Academy of Pediatrics recommends breastfeeding for 12 months or longer if mutually desired, and exclusive breastfeeding for the first 6 months. Dads may feel left out, but they play an important key role in helping mom breastfeed successfully. Dads are the most important support person to a new mother. With dad's support of breastfeeding, often the mother will continue breastfeeding through any challenges or difficult times. Without dad's support, a new mom may stop nursing early. Dads can offer support and encouragement through these early days by saying encouraging words such as, "You're doing a great job. Look how strong he is. He looks healthy and happy. I'm so proud of you, even when it's hard." And dads can help moms get into a good position to breastfeed. They can assist helping get the baby latched on. They can hold the baby's head or the hands. Dads could bring a stool for mom's feet, or provide a healthy snack or food or something for her to drink. Later on, dads may give breast milk through a bottle. Also, moms appreciate dad's help with housework and family meal preparation. Being a grandmother is also an important role, because grandmothers provide support and will often give helpful advice. We encourage grandmas to learn more about breastfeeding by reading brochures from the pediatricians, lactation, or WIC offices. There are several things grandmas can do to support breastfeeding. Help mom get into a good position with pillows or a stool for her feet. Bring the baby to mom when it's time for a feeding. Holding and snuggling the baby when mom is eating, showering, or napping. They can change the baby's diaper and help burp the baby. Doing household chores like laundry and dishes. Fixing meals or a snack for mom and dad. Taking care of other children. Or simply by giving mom and dad space if they ask for it. Grandmas can also provide support and encouraging words towards their daughter or daughter-in-law, such as, "I'm proud of you. You are a great mom. Look how well baby is growing. Keep going even though sometimes it's hard. You can do it."
Grandma thinks you're pretty.
Whooping cough is one of the only vaccine-preventable diseases which we see an increase in reported cases. Several states have reported an increase in cases and/or localized outbreaks of pertussis, whooping cough, including a statewide epidemic in California. To help protect infants too young to be vaccinated, it is very important for family members and caregivers to be vaccinated against pertussis. In most cases, pertussis in infants is acquired from a family member. Imagine how devastating it would be for a family member to give pertussis to her baby. Ask your healthcare provider about whooping cough vaccination today. Whooping cough is one of the only vaccine-preventable diseases which we see an increase in reported cases. Several states have reported an increase in cases and/or localized outbreaks of pertussis, whooping cough, including a statewide epidemic in California. To help protect infants too young to be vaccinated, it is very important for family members and caregivers to be vaccinated against pertussis. In most cases, pertussis in infants is acquired from a family member. Imagine how devastating it would be for a family member to give pertussis to her baby. Ask your healthcare provider about whooping cough vaccination today.
Thank you for watching our program. We hope it has been a useful reference tool. Please remember to call your provider or your infant's provider with questions or concerns regarding you or your baby. For more information or assistance with a variety of topics, here is a list of resources in your area.